Guys, tonight we're talking about genetics and more specifically the MTHFR gene. So you're probably like, why is this important, Janine? Why are we talking about this? Well, it's estimated that 60% of the population has one mutated copy of the MTHFR gene. So why is that important? Well, just having one mutated copy increases your genetic propensity to develop cardiovascular health risks such as heart attack, stroke, blood clots, also neurologic conditions such as Parkinson's, migraine, depression, ADHD, Alzheimer's, dementia, as well as increases your risk for miscarriage, um, and a plethora of other things. Um, and where my interest in this started is with my 9 to 5. So, the majority of my medical sales career has been spent in diagnostics, focusing specifically in women's health and genetics. And so, not only have I been able to be trained by thought leaders within the genetics world, but also um, I've been able to help educate patients and providers as it relates to the diagnostic testing available. And within that, I have been able to have some of these tests done myself, which I uncovered that I have one of the genetic mutations, C to be exact, C is in cat 677T, for MTHFR. And so, um, of course, I started doing some additional research. There's a ton of papers out there, clinical peer-reviewed papers, not to mention we have an expert in MTHFR here in the Pacific Northwest, Dr. Ben Lynch, that I follow. So I'm not a physician myself. I just want to disclose that. But basically, fast forward 4 years from when I originally found out about that mutation and the fact that I had it, I had a conversation with my cousin who's 38, super healthy and active, and all of a sudden has a stroke at 38. So not only is her care team trying to identify, like, why did she have this stroke, but more importantly, how do we prevent it from happening in the future? One of the series of tests that they performed was a genetic test specifically looking at the MTHFR mutation, if she had one. So ironically, we both have the same mutation, and it just encouraged me to maybe put some information out there because I just don't think there's a lot of folks out there, commonplace, that aren't practicing physicians, that know much about this genetic mutation or gene and its function. And more importantly, I don't feel like it's being brought up a lot by the medical world to the patients. And so, why is MTHFR and specifically having that genetic variant? What causes all of this? A genetic propensity to develop these adverse events health wise. Well, it's because our body isn't methylating appropriately. So some chemistry that is critical to the body is converting folate or folic acid into the usable form, which is L-methylfolate. And basically, those of us that have a genetic mutation, and some actually have two mutated copies of the MTHFR gene, not just the one mutated copy. So the folks even that just have the one, it's thought to be that there's a 35% decrease in the body's ability to methylate, or to make that folate or folic acid and convert that into the active form, active and usable form. And so, as you can imagine, the body's a machine, and so it's a trickle-down effect. If we're not converting folate and folic acid into the active form, it starts impacting other organs, such as the thyroid and hormone levels there. I already mentioned the neurologic challenges that can happen. Hey, Emery. because it impacts the neurotransmitters. So I'm not going to get into all of that. There's a ton of data out there, and it's just very interesting. But more importantly, what I wanted to convey right now is what in the heck MTHFR is and why it's important to be tested. And that's the recommendation is that everyone be tested. It's a simple saliva-based test or a blood test. And basically, once you have your outcome there, say you do have one of the genetic mutations, the gold standard for the next step would be checking your homocysteine levels, which ultimately, if your body is not methylating appropriately, you end up having elevated homocysteine levels, which is in itself one key risk factor, or one of the biggest risk factors for cardiovascular risks. So I mention all of this to say, talk to your doctor, have the genetic test done on MTHFR. If you do have a genetic mutation, I would highly encourage you to push them to order the homocysteine levels and identify if you're at the normal range or if you have elevated levels there. And then, more importantly, this is super actionable. You can buy supplements. I use this one, the Ribomag Forte. Sorry, it's kind of bright. The lighting when I do this when I get home after working a full day. Anyway, so basically this is the L-methylfolate, so the active form. So my body doesn't have to struggle to convert the folate or the folic acid into the active form. This is already doing all that heavy lifting. So my point is, just to be your own patient advocate. And again, it was just brought to the forefront of my mind with my cousin, and basically how we can be advocates for our health and take the best care of ourselves as possible. Because the other thing about this supplement, you don't want to buy any L-methylfolate, because you don't want to have a bunch of additives in your supplements. I mean, if you were to look at some of the ingredients, there's a ton of gluten in a lot of these supplements, which research shows if you do have a genetic mutation of the MTHFR gene, you should avoid gluten. There's a lot of data that supports that. So make sure that whatever supplement that you and your provider decide on doesn't have a bunch of additives in it. So again, I encourage you to talk to your physician or provider and get tested. And, if this helps just one person, then I'm a happy camper. So have a wonderful night, guys. Leave comments below, and we'll talk at you soon. Bye.